So let me tell you a story. And this story moves me in every way that I think about it. This is the story of Dr. Amina. She's a practicing physician in Saskatchewan right now. And Dr. Amina's background is that she's from Nigeria and she had practiced for over 10 years. She had delivered babies, she had treated various medical conditions, she had managed several life-threatening emergencies and even led a lot of community health projects. And when you look at Dr. Amina, that is the person you call, this is a complete physician. She does everything from cradle to the grave, right? Now, when she heard about the practice ready assessment program in Canada, she was over the moon because this is an opportunity for her to come in and show what she can do. And so this doctor finally gave it a chance. And she knew that she's coming to a system which values her skill, her compassion, and everything she brings to the table. So what she did was that she spent weeks, preparing her documents. She gathered her certificates. She rewrote her CV. She even copied a few formats she found online, how to put a CV together. And she submitted it to the SIPA program. Now, she then waited and waited and waited. And a few weeks later, she got an email which started with the very sentence you don't want to read, which says that we regret to inform you. When you see that particular sentence, you don't want to even continue to read what the letter says, because you know that everything which comes after that is not good news, right? So her heart sank. She read the letter over and over and over again. And she was trying to figure out what exactly has she done wrong to be rejected by the program. Now, this doctor hadn't failed any exam. She did not have any problems with her credentials. She did not have any gap years. Her references were really, really strong. So I asked myself, what happened to her? And the answer was her CV. Her CV. In the practice ready assessment program, whether you are doing it from British Columbia, from Alberta, from Nova Scotia, from Saskatchewan, Newfoundland, Labrador, Ontario, your CV is the first document that everybody will look at. So even before you get into the room, your CV is speaking for you, right? That is what everyone will look at. So before you even get an interview, before you get to the point where someone is going to review your personal statement, before people even learn what your actual name is, it's the first impression you create, your CV, your curriculum vitae. And as the saying goes, you never get a chance to make a first impression again the second time. So when her CV landed on the reviewer's desk, it looked okay. It looked fine, right? But the problem is that CV did not speak. And what do I mean by that? It did not speak because it did not tell the story of Dr. Amina. It didn't show her as the leader she was back home in Nigeria. It didn't show her as the caregiver. It didn't show her as, this doctor who is so committed. And so what happened? It was just passed, right? Because so many people are applying. Now, and it wasn't because she was not qualified, but it was because she did not allow her CV to speak for her. So a few months later, she contacted us at MedCognito, and that's something we do. We also review the CV and the personal statement of a lot of candidates. So she contacted us, and I remember her voice, she was so tired, she was disappointed, she was ready to give up. And I told her, hey, Dr. Amina, please don't do that. We don't do that here. You can't give up when you have such a huge opportunity sitting before you. So what we did was this. I asked her a few questions, and this is what she told me. She was like, you know what, Dr. Bruni, I know I'm a very good doctor, but it feels like the system does not see me. Now, this is what I told her. And I've been telling hundreds of IMGs, and our coaches tell a lot of IMGs this story. That look, the problem is not about the fact that the system does not see you. Rather, the CV did not show up. It's very different. The system seeing you and the CV showing up. Two different things. So together, what we did was that we started building a new CV for her. We started from the beginning. And the first thing we did was we fixed the header of her CV. That was the first thing. We made sure that her CV had her full name. the city, her contact information, which was crystal clear. And we made sure that she presented a professional looking email. That's the first thing. That's another thing I see that people make a lot of mistakes about. We also made sure that she had a working phone number, because you'll be surprised. You'll be surprised at how many applications which get delayed and which at times gets tossed just because recruiters and these bodies cannot even reach the candidates, because some people are presenting CVs they've developed a lot of years ago, and they've not even taken the time to review the phone number they put on that particular CV. So after the header, then we went to her profile statement. And these are the few lines at the top that tell the reader who you are as a doctor, right? So I asked her, Dr. Amina, if someone should introduce you at a medical conference, how would they describe you? And so she paused and she was like, how does that apply to my CV? I was like, look, that has to apply in your CV. So she just gave me these words. And I remember those words very well because I have a copy of her CV. She said, I'm a compassionate physician with over 10 years of experience providing primary care in rural and urban communities dedicated to patient-centered care. I was like, that is it. This is the kind of thing we want to see in your statement, right? Because this particular statement is very honest, it's very professional, and it's very powerful. It stares at you when you are reading that particular CV. And you realize that the way it was stated, it did not talk about I, it did not talk about me. It was just talking about the person in the third person, right? So in the third person, it's just a confident third person introduction that made her sound like the capable doctor she already was. So after the header and the statement, we went on to her education. We listed every degree she has, every rotation she's done, every training program she's been in, all with exact dates, the cities she's done it, and the countries she's been trained in. We made sure there were no missing months, okay? No confusion. It was just clarity. Everything was clear. Then we came to her clinical work experience, which is where her story actually came to life. So before the meeting, she had written, I treated patients, which was very vague, and I managed clinic cases. And so many candidates make that particular mistake. So we replaced those vague words with measurable statements. And some of the measurable statements were like, for example, diagnosed and managed acute and chronic conditions across internal medicine, pediatrics, obstetrics, and emergency medicine. Can you imagine? Like when such a thing is on your CV starts breathing. Another example is performed wound suturing, neonatal resuscitation, and fracture stabilization. Doc, if you were the recruiter, when you see such things, you start smiling, right? So that's how a reviewer will see that you are competent through specifics, not just summaries. So now we added her licenses and the exams she's taking and her certification. So we added her MCQ1, her NACOSKI, her English language course, and even some courses she had taken, like the ATLS and the ACLS, which had expired. We still put those there, stating that yes, they've expired, but she has registered to take new ones. Everything showed a timeline of what she's done, the effort she's put into her medical career, and the growth that she's had over the period. And we then included another very important part that a lot of candidates forget about. That is her non-clinical experience. The small things that, she thought did not really matter. I was like, no, we need to put it in there. We need to put it in there. So she had volunteered at a vaccination clinic in her community. I was like, Dr. Amina, it has to be there, right? She said, Dr. Brony, really, is that important? I was like, come on, that is gold. That is gold. Put it in there, because that one experience says something powerful to the recruiter. It shows that Dr. Amina was not just a doctor who practices in a clinic, but that she also concerned about public health, the good health of the people in general. She's not just a private practitioner. Finally, we polished everything. We made sure that we polished the formatting of the CV. We made sure that we polished the font size, how the CV was spaced, the consistency of the word and the language which was used. And when she looked at her CV, she was like, Dr. Boni, are you sure this is me? I was like, yes, this is you. But it's all about how you present yourself in your CV, right? And then I smiled and said, this has always been you. Now your CV finally shows who you are. A few months later, she applied again. And this time, the practice ready assessment program of Saskatchewan picked her up. And when the results came, she called, she was crying. She was like, Dr. Boni, you can't just imagine what has happened to me. She opened her email and the email said, Dr. Amina, congratulations, you've been accepted into the program. And on that day, she really cried. And I've seen so many candidates go through this, crying because finally they've gotten what they were looking for. But today she's working as a family physician in Regina, and all that experience is gone. It was the same person, it was the same heart, it was the same qualifications, and there was one difference. The difference is how she told her story earlier and how her story was polished so that she could write it better. So, Doc, as you watch this, let me ask you, the CV you have right now on your computer, right? If you should press submit, what is your CV saying about you? Tell me the truth. What is your CV saying about you? Does it tell your story clearly? Or does it show the growth you've gone through, your competence and your readiness? Or is it just a list of job titles? That's no. In Canada, your CV is not just about your paperwork. It's a professional handshake you are giving to the recruiter who is going to pick you and say that, I think this doctor is fit for this particular community. And so your CV is basically saying, here I am, here I am. This is what I present on the table. Therefore, use that. And based on the information you pick about me, pick me as the suitable candidate for this job. Right? So if your CV is current, it's complete, and it's clear, you've already set yourself apart from many, many doctors. Because a lot of us take it for granted. But if your CV is messy, it's inconsistent, it looks very generic, right? And, it's like what everybody writes, then, doctor, you become invisible in the pool of people, no matter how good you are. Because, people will not know how good you are until they first see it on paper, and then that will open the door for interviews and everything. Okay, so here's my challenge to you. Take 1 hour this week. Read your CV like a stranger would read it. Read it as if you've never seen it before. The question I want to ask you is this: will you hire yourself? That CV you wrote, will you hire yourself? Okay, and if the answer is anything less than a confident yes, then it's time for you to rebuild your CV. It's time. And if you want expert eyes to look at your CV like the way we looked at Dr. Amina's CV, that's what we are here for. We have special coaches who deal with that. Our team of doctors deal with these issues so that you can present a professional, well-looking CV so that everybody will be happy about the work you are putting into presenting yourself as a good candidate for the practice ready assessment. So if you are interested in that, you can just click on the description and the link below. You can book a one-on-one session with one of our coaches, and we're going to review your CV in detail, right? In detail, to make sure that you get the best out of these things. So just like Dr. Amina, your next email might not start with, "We regret to inform you," right? Rather, it may say, "Congratulations, Dr. Abdul," or Dr. Hamza, or Dr. Rose, you've been accepted. And when that day comes, we'll be right here. I'll be waiting for that call from you to celebrate with you so that you can go into the community and go serve the people of Canada. Because, at MedCognito, your dream of practicing medicine in Canada isn't just a goal. It's a story we are helping you to tell, okay? So hit us up. Just give us a call. We'll guide you through it. See you on the other side of success.